Okay, hello. Tinnitus and suicide, understanding the connection. You see, in this video, we know that tinnitus is a condition that affects millions of people worldwide. We all know about the buzzing and the whistling, the sounds in the ears, and the symptoms of tinnitus can be extremely distressing. And it's important to understand that the condition can have a profound impact on a person's mental health and well-being. In some cases, tinnitus can actually lead to depression and thoughts of suicide. And some actually do go and take that step further. So it's really important to understand this. So first of all, what is tinnitus? We know that I will keep it brief because we've lots of other videos on what tinnitus actually is. But for those just joining us, because they may have joined us for this, it's a subjective experience of sound that is not caused by any external source. And they say the sounds can range from a faint ringing to a really loud and persistent noise that can be continuous or intermittent. And tinnitus is often caused by damage to the inner ear, but it can also be the result of a variety of other factors, including age-related hair loss, exposure to loud noises, and ear infections and head or neck injuries. So those are the main reasons that we get tinnitus. Now, the connection between tinnitus and suicide, tinnitus can have as I said, a really big impact on the person's quality of life. So it can cause a lot of distress and anxiety and the sleep disturbances. So in some cases, tinnitus then can lead on to depression and thoughts of suicide. And I did do a video a while back about the percentages that actually do contemplate suicide, because, although people sometimes almost make tinnitus sound as though it's some jokey type of subject, if you have it and have it to the extreme, it really is not. It can be a serious and really debilitating condition to have. So it's important to look at the connection, with tinnitus and suicides. It's well documented, with studies showing that individuals with tinnitus are at an increased risk of developing depression and considering suicide. So it needs to be dealt with. Understanding then the risk factors. Now, it's important to understand that not everyone with tinnitus will experience depression or thoughts of suicide. However, certain factors can increase the risk, including, obviously if you've got severe tinnitus symptoms, the long-term exposure to loud noise. Once you get tinnitus, you need to start avoiding, or at least putting ear defenders on to stop the exposure to even more loud noise. And if you suffer with a history of depression or other mental health conditions, then tinnitus will have a bigger impact on you. Substance abuse and chronic pain or sleep disturbances. Sleep is really important. Can't stress that enough on that side of it. But so how to cope with tinnitus and prevent suicide or suicidal thoughts? So if you know someone who is struggling with tinnitus and depression, it's important to seek the help. That is the first step all the time. Here are some tips for managing tinnitus and preventing suicide then. Talk to a doctor or mental health professional. They can help you manage your symptoms and provide support. And I think it really is important, go pick up the phone, go to your doctor, or if you know somebody who's feeling this way, you phone for them. It really is important. Don't leave it. Practice stress reducing techniques such as meditation, exercise and deep breathing. I've got a fantastic way for breathing. I give this to all my clients, and I have done over the years, how to breathe and meditate and relax. And it has a fantastic way of helping the body and mind. Everybody feels fantastic after they've done this. Once they've practiced it a few times, so have a look for that. Click on it, it's free to have a go. So the other thing is join a support group of individuals with tinnitus. Talk to others who understand what you're going through and can be incredibly helpful. And at the same time, don't get mixing with the negative ones, the one that are all doom and gloom. You need to be surrounded by positive people because you can deal with this in a positive way. It doesn't need to be, I'm worse than you, you're worse than me, I'm worse than you. All this does nothing for your mental health. So join the group by all means, but get one where there's full of positive people. Get plenty of rest and avoid exposing yourself to loud noise. As I said, wear ear defenders if you're going anywhere loud. You know, you don't need the big ones that look like, little kiddie ones. You need ones that, will stop you. You going to a concert or going to a club or anything like this. You can put discreet ones in there to stop this. Consider cognitive behavioural therapy or other forms of therapy to manage your emotions. Hypnotherapy, and I say this is my background, I'm a big believer it can really help. Okay, seek treatment for depression and other mental health conditions, again if necessary. I think this is so important that you actually deal with it, because most cases it will not go away on its own, but it will go away because it's so easy to make it go away if you get the help. So to conclude on this, it is a complex and distressing condition, is tinnitus, and it can have a big impact on your mental health and your well-being. If you know someone who is struggling with tinnitus and depression, it's important to seek help, and with the right support and resources, it's possible to manage tinnitus and prevent those suicidal thoughts and even worse. So have a look through this channel. There's lots of things here that can help you. I'm going to put the link for the video to help with your meditation. It really does work. It works for everybody, and it's a simple way to follow and get used to it. So on that note, I would like to wish you all good health, take care, and I hope you've got something from this, but I'll see you in the next video. Bye bye for now.